The NHS crisis. Are unqualified professionals treating patients in England? The UK's National Health Service, NHS, is facing a deepening crisis, forcing it to increasingly rely on the third sector, charities and community organizations, to provide essential patient care. While these organizations offer valuable support, an alarming trend is emerging. Underqualified professionals are being tasked with treating patients, raising serious concerns about patient safety and the quality of care. This exclusive report reveals the stark reality facing the NHS, where overwhelmed GPs are signposting patients to services that may lack the expertise and qualifications to adequately address their complex needs. This practice, driven by escalating pressure and staff shortages within the NHS, is pushing vulnerable individuals into the care of individuals who lack the necessary training and experience. Several charities have reported being inundated with requests for help, struggling to cope with the sheer volume of patients referred to them. Staff, who often do not possess the specific qualifications required by NHS standards, find themselves grappling with the treatment of increasingly unwell individuals. The situation has sparked widespread concern among medical professionals and patient advocates alike. Dr. John Van Niekerk, chair of the General Adult Faculty at the Royal College of Psychiatrists, eloquently summarized the issue. It is absolutely crucial that patients are referred to services equipped to meet their specific and often intricate needs. Care must be delivered by qualified and experienced practitioners. Charities and community organizations play an invaluable role in supporting mental and physical health, but their support should complement not replace specialist care when it is fundamentally required. His statement highlights a critical distinction often blurred in the current crisis. While charitable support can significantly enhance patient well-being, it should not be a substitute for professional medical intervention when specialized expertise is necessary. The implications of this alarming trend extend far beyond simple administrative inconvenience. The potential for misdiagnosis, inappropriate treatment, and ultimately, harm to patients is significant. The pressure on already stretched third sector organizations is unsustainable, threatening to compromise the quality of care they provide to all their service users. This is a systemic issue that requires urgent attention and a comprehensive reassessment of resource allocation within the NHS. The case of Amercine Manley and her daughter vividly illustrates the dangers of this system. Manley's daughter, who is autistic and suffers from avoidant restrictive food intake disorder, ARFID, was advised by an NHS dietitian to self-refer to First Steps ED, a local eating disorder charity receiving some NHS funding for psychological support. While First Steps ED may provide valuable services, the referral raises crucial questions regarding the appropriateness of relying on a charity, even one with partial NHS funding, to provide specialized psychological treatment for a condition as complex as ARFID, especially when the patient also has autism. This incident highlights the lack of oversight and potentially inappropriate delegation of responsibilities within the NHS system. The question arises: if the NHS lacks the capacity to provide adequate care, should it be referring patients to organizations that may not possess the necessary qualifications and resources to effectively treat them? This practice seems to shift the responsibility and burden of care onto already overstretched community services, potentially jeopardizing the well-being of vulnerable patients. The reliance on underqualified professionals within the NHS is not just a symptom of underfunding. It reflects a deeper systemic problem concerning resource allocation, workforce planning, and the integration of community services within the broader healthcare framework. Addressing this issue demands a multifaceted approach. This requires immediate investment in training and staffing within the NHS, coupled with clear guidelines and oversight mechanisms to ensure that patient referrals are appropriate and that individuals receive care from adequately qualified professionals. Further investment in community services is crucial, but this must be accompanied by robust quality control and clear delineation of responsibilities to prevent overburdening charities and ensure patient safety. The current situation urgently needs a thorough investigation and a swift, decisive response from the government and NHS leadership to avert a potential catastrophe in patient care. The future health and well-being of countless individuals depends on it.